Hi, good morning. My name is Adam. Thank you to the OIS faculty for the opportunity to showcase here this morning. Much appreciated. So before I begin, I want to open with a story that happened several years ago. This is before I was with this organization, and I was in the Charlotte area observing post-ops with a well-known cataract refractive surgeon, Dr. Ivan Mack, also a good friend of the OIS community here. And before one particular post-op, his staff stopped us at the door to warn him, right? The dreaded 20 unhappy patient scenario many physicians run into. And they said, Dr. Mack, this is the lady that has the multifocals that called. She's pretty upset. She's a month out, surgery was going great, and now she's been complaining in the workup that the last week or so, the quality of vision's not the same. She's certain something happened with the lens. She thinks it moved, regretting the investment. And Dr. Mack turned to me, he looked through the chart for a moment with total confidence then. He looked at me and he said, it's actually really good you're about to see this post-op, because this happens today still in advanced cataract surgery, and when it does, with the quality of vision and the technologies we have, reasons 1, 2, and 3 are always ocular surface disease related. And I'm going to show you how we've been prepared for it and how we manage it on the back end. And I'll come back to this story in a moment, but solving that problem Dr. Mack was facing as a physician is what our company was founded for, originally named Tear Lab and launched in 2008. With the goal of bringing into eye care something so common and almost taken for granted in modern medicine, objective laboratory testing, yet was foreign in the ophthalmic space. And so we brought to market the first CLIA-waived test with osmolarity testing. Fast forward to 2022, we're now private equity backed. We're approaching our 25 millionth test globally across almost 50 markets. And we've recently rebranded this year to prepare for a new portfolio expansion. One of those launches I'll talk to you about momentarily, but also our vision is to be the world's leading corneal health company for providers and patients. And we thought we needed a name that moved beyond the one product company founding and helped reflect the growing vision we have to address a broader set of unmet needs in corneal health. And so why we measure osmolarity? Because it matters. And the human body likes to maintain a tight homeostasis for salt content. As you know, salt is corrosive in nature, and high salt does not interact well with tissues, can cause cell stress, inflammation, and damage, and the cornea is no exception to that. On the left there, you can see healthy corneal epithelial cells in a natural 290 milliosmol per liter range. That's where the whole body likes to stay. Again, the cornea tissues, again, no exception. On the right, within only 24 hours when exposed in a controlled setting to elevated levels of osmolarity, you can see rampant cell stress and death beginning to occur. This is why this matters, especially in an age of targeted refractive outcomes. Dr. Tradler's PHACO study has shown us nearly 80% of cataract age practice patient populations will present with at least one sign of OSD, and it's not just elderly patients. In fact, in this year's JCRS title study in the April issue, one of the largest cohorts analyzed for younger refractive vision patients, we learned nearly a third of those younger patients coming in for laser vision surgery have abnormal osmolarity as well. And it matters most because it matters to vision. And when patients have elevated osmolarity, nearly 20% of the time, it can cause fluctuations in that visual outcome. The tear film is the first barrier for refractive vision as light moves back to the retina. And it can be in order of a diopter or greater. So pretty significant, especially in a world where patients are often paying $5,000, $10,000 plus for bilateral refractive procedures, whether a cataract or a LASIK setting. And this is what Dr. Mack knew he was walking into, and it was the first time I saw it. Again, I wasn't even with this company, and I was amazed by this. When he was flipping through the charts, he saw lab tests, he saw objective data, and he went in with confidence. And the conversation he had with that patient was, ma'am, good news, your surgery's fine. The lens is exactly where I want it to be. You're healing well. But, and then he used these magic words, but we need to talk about your lab results. Because we saw this issue before surgery, we talked to you about needing to manage your osmolarity and your dry eye disease. We got you fine-tuned before the operating room, but I see it spiking again. And he asked her, are you staying on top of your therapy? And the patient said, no, I thought I could stop the drops once I got to surgery. So what started with an upset 20 unhappy patient, ready to blame a surgeon, ready to blame the IOL or the investment, actually turned into an empowered patient, reminded that they have a role to play in preserving and managing the health to protect the investment in their vision. And recently, the ASCRS Cornea Committee actually updated their algorithm to include osmolarity as an essential test in the preoperative workup for those reasons. We're all aware, I think in this room certainly, of the growing demand and opportunity in the premium cataract refractive space. Premium cataract procedures expected to be done in over 5 million cases globally this year. creating enormous value not only for the patient quality of life, but for industry, incremental value, and for the providers as well. Our company was not founded on this segment, but it's where we're heavily focused now because of the demand and the reasons I've shared with you this morning. And this is now the fastest growing segment. Over 90% of all osmolarity adoption taking place in the US right now is taking place in busy cataract refractive practices. That's where the patient demand and volume opportunity is highest. And at about 10 to 15% penetration, we think our greatest growth opportunity is still ahead of us in this large market. But serving this market has very specific needs. A busy cataract practice today serves a high volume premium patient model where technology has to adapt to the practice, not the other way around. So our 25 million tests to date have taught us a lot about what this market needs, and we know that this solution has to be a portable, practical, and precise application of the technology, which is why we're excited to launch this quarter the next generation of our product. We've taken everything and crammed it down into a handheld to offer that portable, practical, and precise method for analyzing osmolarity in that patient practice. The secret sauce behind this is actually pretty simple. Laboratory medicine, no different than any primary care setting you may have lab tests done. You need a mechanism of consistent, reliable specimen collection, and then you need a means of analyzing that specimen, usually a lab or a base unit. We've now integrated that into a single elegant portable device, allowing you to do that in the palm of your hand. The techs can carry it around. It fits into any practice model, and it's built on a proven industry leading coefficient of variation. We have less than 1.5% CV by comparison, because we are not a lot of laboratory testing to look at in eye care. Commonly used tests like blood glucose and cholesterol are several times higher than that. So we feel really good about the accuracy, and now we have the platform and the portability to deliver the need. Now, HIPAA concerns can be put aside. I'm going to share a video here. This is our office manager at Trukera, Lorinda. She's given me written consent to share this. I'd love to meet you, come by, we'll show you the device, but I do want to show you, when we say rapid testing, we don't mean the COVID definition of 15 to 20 minutes, we mean 10 to 15 seconds. So this is truly a rapid test. You're going to see an end-to-end procedure here. The tip goes on. That's the sample collection device. That first beep that you hear, it's right there within a second, tells you a 50 nanoliter collection has been obtained. It's now working its way through a real-time temperature analysis of the specimen. You'll hear a couple of relays. It's doing the osmolarity analysis, and it'll show up here on the screen. So this is a great example. Lorinda's an otherwise younger cataract-age female who, if otherwise asymptomatic as well, by the way. She doesn't have signs of dry eye other than occasional fluctuations in vision, but that's a high osmolarity reading. So this is a perfect example of a situation where a potential refractive investment patient would need to be aware of a secondary condition to manage. So thank you for the opportunity to share. Would love to meet you around if you're today, and look forward to the rest of the meeting.